afternoon, everyone, and welcome to my presentation on the treatment of post-traumatic stress disorder in veterans. So to begin my presentation, I'm going to give you guys a little bit of background information as to why PTSD in the veteran population is a national health concern currently. Of course, for me, as a nurse at the VA, I see this every day. However, given the global scale of this issue, I would like to point out a few facts. So first and foremost, 9.6 million Americans live with a serious mental illness. However, given that number, only 40% of veterans that are actually diagnosed with a mental illness seek treatment. That's a lot of men and women not seeking help. This, therefore, contributes to a really high suicide rate within male veteran populations. I don't have the female statistic, but within male veterans, there are 38.3 suicides per 100,000, as opposed to the U.S. statistic of only 19.4 suicides per 100,000. PTSD, due to the anxiety, the lack of sleep, the depressive episodes, is a risk factor for suicide. So how many of our veterans actually have PTSD? Well, of the 1.6 million men that were deployed to Iraq and Afghanistan, 11 to 20% of those returning veterans will have PTSD. 12% of the Gulf War veterans and 15% of the Vietnam War era veterans have all been diagnosed with PTSD. Due to personal experience at work with veterans suffering from PTSD, I knew I wanted to guide my literature research focused around post-traumatic stress disorder and the treatments available to veterans currently. The term PTSD has only been around since the 1990s, so research in these different treatment modalities is rather new. My PICO question, therefore, was, in service members, either active duty or veterans diagnosed with PTSD, how does the use of prazosin compare to sleep-targeted cognitive behavioral therapies in improving overall sleep quality? So what exactly does the research say? Well, I reviewed 3 separate articles, 2 of which are randomized controlled trials and 1 of which was a randomized parallel group trial. The 2 interventions being cognitive behavioral therapy and prazosin. Overall, and compared to a placebo group, or what they referred to as a usual care group, which was just monthly check-ins with a psychiatrist and use of antidepressants, both prazosin and CBT were more effective overall in improving sleep quality within veterans. CBT, in comparison to prazosin, had a greater effect on the long-term follow-up plan. However, in my research, I found that there's actually not very much research done in combined therapies of both psychotherapy and psychopharmacology treatments. Usually it's just either CBT, prazosin, guided imagery versus a placebo group. So moving forward, I would like to see research done on these combined therapies. So moving forward, how can we improve nursing practice? Well, more and more evidence-based research within this topic field, because as I mentioned before, there's not a heck of a lot out there currently. I would like to see more long-term randomized trials being produced on combination treatments of both CBT and prazosin together versus individualized interventions and a placebo group. That way there's more data and more comparison being made to find the best and most effective treatment for these guys. So after reflecting upon the data found in my literature research, I created a proposed intervention that could be utilized within the veteran healthcare system. I believe that veterans diagnosed with PTSD and are prescribed prazosin to help with their sleep efficacy, they all should be referred into a CBT or at least other psychotherapy program to maximize the synergistic effects between the pharmacological intervention and the psychotherapy. In treating mental illness, the best we can do is help these veterans maintain a stable life, and in doing that, you need to incorporate all modalities into their treatment plan. So to conclude, the combat war veterans are a very unique population, but as more and more are returning from Iraq and Afghanistan, psychiatric nurse practitioners have to be in the forefront of treatment for a lot of the coinciding mental disorders and traumas that these guys are returning with. So hopefully this presentation gave you a little tidbit of information to help you move forward in your practice. Thank you.